I've been diagnosed with a irregular heartbeat, and they want to do a spinal tap.
James has a lot of medical complications. However, he comes with high needs because he's new to Minnesota. He doesn't know his way around. He doesn't know the different systems.
I do medication management with James. So I do assessments, vital signs, set up his medications once a week. I do appointments as well as Social Security.
Anything from scheduling appointments, rescheduling, calling HCMC.
I feel like I'm around people that care about me. I ain't never really knew what had no loving in my family.
He has a group of people that's working with him now. Any one of us can meet his needs, and we continue to communicate to make sure that we're all on the same page.
It helps the client have a sense of direction as well as compliance and or adherence to their medications.
With clients like James that are new to Minnesota and he has all of these things being thrown at him and all of these changes coming, it's nice to know who we can talk to about other areas that we don't necessarily know.
And the patients have better outcome. Patients have better outcome because they realize you become like, it's like a family.
I've never been responsible, so it didn't, I was always been just me most of the time. So I didn't too much worry about myself. Now that I'm getting all this help, I feel better about myself.
This is all about the total patient or client in mind. The staff feel like they're much more effective. I think they feel like they're a part of a working team that is meeting the needs of their patient or client in ways that they haven't been able to meet them before. We recognize by working together and by talking to each other that we could really provide a more seamless experience, much more efficient experience for the person, and really get them the needs in a much more cost-effective way.
I was at a shelter. It was pretty rough.
When I started working with Jamal, he was in kind of a dark place. I was kind of in charge of helping coordinate the care and discharge planning for him.
They helped me with my appointments, with my housing. They made my life more manageable.
I would definitely see change in him as far as, being stable, having a place to go. Just overall, his mood change, his interaction with us, engaging with his extended family and friends.
They all have my back. I feel better about myself, being able to do this, and they provided that for me.
I think it's been good in that, you're sharing resources. You have kind of a sounding board.
Making sure that we cover all the areas, based on his needs, and say, how can we work as a team to make sure that we accomplish this goal.
They care. They treat you like family, and I'm blessed. I mean, I feel blessed to have these people in my life right now, putting me on the right direction and the right path.